Welcome to the Easy Baby podcast, where we share practical tips and information to make your pregnancy and the first months of your baby's life the best they can be. Visit easybaby.co.za for more information on our online courses.
Hello, moms and dads, and welcome back to the Easy Baby podcast series. Today it's episode 5, it's a bumper edition, and it's all about reflux. We're going to cover what reflux is, why reflux happens, and when you might need to see your doctor concerning it. Before we get into the show, I would just like to send out a huge thanks to Pietru from Goodnight for hosting me at their recent baby and child sleep seminar. It was an excellent event, and it's always great to get this opportunity to be able to speak to so many new parents and explain chiropractic care, as well as have the opportunity to sit and learn from the leaders in childcare. I got a lot out of that seminar with Goodnight, and I think you could get a lot out of them as well, especially if your little one is having sleep issues. I suggest you head over to goodnightbaby.com and maybe get one of their ladies in purple, as they call them, to come over to your house to put together a step-by-step sleep plan for you and your child. As always, before we get into the episode, please keep in mind that the Easy Baby podcast is for reference only. The show should not take the place of your healthcare professional and his or her expertise in the diagnosis and treatment when it comes to the health of your baby. So one of the questions that I hear a lot in practice and when I do talks is, how do I know if it's colic or reflux? Now, this is a great question because both of these issues have the ability to mimic each other so well, but it's important to be able to spot the differences so that we can do the right things for our babies. Colic, as we discussed in previous episodes, is a behavior. It's something that babies do rather than something they have, and episode 2 and 3 have some great information concerning this. Whereas when we talk about reflux, we're talking about a physical thing that actually happens to your baby. We can measure it, we can classify it, and we can treat it. So reflux is what happens when your baby has a feed and those stomach contents move up instead of carrying on down. So instead of the milk moving from the stomach into the bowel like it's supposed to, the milk tracks back up the esophagus or the food pipe. And this happens because the valve between baby's stomach and esophagus pops open and lets the milk back through. So these valves are weak in babies, and they tend to pop relatively easily when there's too much pressure in the stomach. There can be pressure in the abdomen as well, or the valve itself just isn't working properly, and all of these can give rise to reflux. It's important to remember that reflux can happen at any time. It's not just positing, which is that little bit of milk that pops out of baby's mouth after a feed. True reflux can happen right after the feed, or it can happen up to 3 to 4 hours after the feed, just before the next feed. Whereas colic hits its peak at 6 weeks and it ends around 6 months, reflux generally arrives later and it peaks around 4 months, and it can take up to a year or 2 to resolve, depending on the underlying issues. Although we must say here that reflux generally clears up or at least gets a lot better when you start to introduce solids. Please remember, though, that that's not an indicator to introduce solids. Anything before 4 to 6 months can start up allergic reactions. So reflux is a normal part of life. For the most part, it's not harmful. It doesn't need to be medicated for. It's really common, and it's a natural event in babies. Firstly, because they have the weak valve, like we spoke about, but also they have a really short esophagus. And this is bad at holding back the milk pressure. Also, our modern Western babies spend way too much time lying down, and this encourages milk flow backwards and forwards over the valve. Lastly, our baby's diet is exclusively made up of liquid, which is easily regurgitated. So if we take these facts to put them in perspective, you would have to imagine yourself drinking 14 liters of milk a day and then lying on your back for 18 hours of that day. You are going to puke as well. It's just physics. Preemie babies are most likely to suffer reflux because, as you can imagine, their valves are even more underdeveloped than the full-term babies. And there's a good likelihood that preemies were tube-fed in hospital, and tube feeding forces the valve open for a long period of time. This makes it very difficult for that valve to start working properly initially. This does get better, though, as they develop over time. If your baby fits this reflux profile, then you've probably done some investigation into reflux, and you've more than likely come across a couple of terms. So GER or GOR, GER or GOR, are really common ones to come across, as are GERD or GORD. And these terms can get really confusing. So GER or GOR both stand for gastroesophageal reflux. Some countries just spell esophagus with an O and others spell it with an E. So that's the only difference between those. But both of those refer to mild, uncomplicated reflux. But when we get to GERD or GORD, GERD or GORD, that stands for gastroesophageal reflux disease. And this refers to moderate to severe reflux. So what's the difference? Well, GER is normal, run-of-the-mill, uncomplicated spitting up. While GERD or GORD, even though the word has disease in it, it's not a disease. It rather refers to babies with reflux who have developed complications as a result of that reflux. And those complications are usually due to acid that moves from the stomach into the esophagus. Reflux can either be milk that obviously comes out of the baby's mouth, as in vomiting or spitting up, but it can also be silent. Like we said, the definition of reflux is stomach contents moving up from the stomach. And silent reflux is the tricky one, because the signs that your baby is refluxing are a lot more subtle and sometimes not even there, and it's a lot harder to pick up. So to make this more easily understandable and to get the mechanics of reflux, we divide reflux into 4 groups. So the first type that we talk about is vomiting with no acid. These are the happy chuckers, or the happy spitters, we sometimes call them. They happily puke up tons of milk every day and they smile like nothing's wrong. And why? Because they aren't actually upset. They're just getting regurgitation and then they're carrying on with their lives. In my practice, we know these babies as supermodels because these are the babies that eat everything. They then throw it all back up again and they get to have 15 wardrobe changes a day. You might even notice that sometimes these babies spit up more milk than you are convinced you've put into them in that last feed. And you're kind of left wondering how that happens. So the stomach of reflux babies also tends to work quite slowly, and it takes quite a while to move the contents out of the stomach. And that means that a lot of the last feed is still sitting in the stomach when you give the next feed, which means when they vomit, they are actually throwing up more than what you've just put in. Now, the only thing to worry about in this type of reflux, these kids, is weight gain. If they are spitting up a lot at every feed, they might not be getting the right amount of calories. So it's really important for these kids that we weigh them every week, on the same day of the week, on the same scale, with the same amount of clothing on, to check that their weight gain is on track. If they are gaining weight well and still throwing up a lot, it might be a thought to feed slightly less, seeing as they are doing just fine on the amount that's staying in their system. So the second type of reflux is vomiting up with acid. So these are the kids that vomit and then cry. In this case, stomach acid is moving up along with the regurgitated milk, and that acid burns the lining of the esophagus. While the stomach has a protective lining which keeps it from being burnt by the acid it produces, the esophagus doesn't have any kind of protection like that, and it can be quite badly affected by acid passing through it, leading to what we call esophagitis, or inflammation of the lining of the esophagus. The good thing, though, about this type of reflux is that at least the acid is being removed constantly from the throat, and it's not being given a long chance to sit and burn. Classically, this type of reflux shows up as fussy feeding. These are babies that attack the breast and then shake their heads from side to side. They also tend to arch their backs quite a lot during a feed. Eventually, they arch so much that they actually break the latch, and they can do some pain crying because the new milk is irritating the burnt area of the esophagus as it passes down the throat. This causes kids to back away from the feed because the risk of being in pain has now become more than the reward of getting food. These kids don't do well if you put them down straight after they've had a feed, or if you've given them 1 or 2 burps and then put them down straight away as well, because what happens is as that air comes up through the valve for the burp, it can bring a little bit of that acidic milk with it. Weight gain is also a big concern here because, again, they are throwing up, and we want to make sure that the calorie content is right. And in both type 1 and type 2, we want to make sure that babies are not getting dehydrated because they're throwing up so much. And the best way to check that is to make sure that every nappy they have is wet. A third type of reflux is silent non-acid. So silent reflux is when the stomach contents move up into the esophagus but not out of the mouth. They just sit there. The milk sits at the level of the throat. This is still considered reflux, like we said just now, because the stomach contents have actually moved up into the esophagus. This usually happens because these babies don't have the coordination yet of their throat muscles to be able to contract and push the milk back down or push it out when the pressure sensors on the throat are not activating properly to get the muscles to clear the esophagus. So as these babies develop, this type of reflux can very quickly become vomiting. And these babies become your happy chuckers or happy spitters overnight when those muscles in the esophagus start to work properly. These babies commonly cough a lot. It sounds like they are constantly trying to clear their throats, and they are aggravated. Which is because they are aggravated. It's irritating to have fluid sitting that high up in the throat. Ask me, I know firsthand. But they don't generally scream in pain because it's not that painful. It's more frustrating. Having milk in the back of the throat, however, can lead to other complications like blocked sinuses, possible choking events, and even ear infections. The last type of reflux that we see is silent with acid. And this is the bad guy. This is what is misdiagnosed and much overlooked because it mimics colic and other conditions so well. Now, as with type 3, there is no spitting up. There's no vomiting here, so there are no obvious signs of reflux. But the acid that moves into the throat doesn't get cleared. So this acid has a lot of time to do damage to the lining of the esophagus. How bad this reflux is and how much your baby cries depends on how much acid is in the throat and how long it stays there. These babies have the same bad feeding experience as type 2 reflux babies, but they also scream out of the blue whenever that burning becomes too much for them, which is a very colicky behavior. Their breath tends to have an acidic smell to it. They have a very pained expression while eating. This type of reflux can develop some pretty serious complications. These are the babies that start to get poor weight gain, bad sleeping, chronic coughs, chest infections, wheezing, even general failure to thrive. And if it's severe enough, even conjunctivitis and dental issues have been noted in these kids. Studies have also shown stomach acid present in the fluid that comes out of some children's ears when they have grommets. Now, reflux should get medical attention if baby's weight gain doesn't get back on track. If they have consistent projectile vomiting, because this can be a sign of a blockage rather than a normal reflux, and if the color of their vomit changes, if it changes to green or yellow or red, your doc needs to have a look. Also, if your baby starts to develop trouble with breathing, or you notice blood in their stool along with reflux, these are all possible markers that there are other organic problems maybe along with the reflux, or that the reflux is a symptom of those other problems which needs to be attended to.
Please feel free to contact the show at any time with questions you may have or topics you would like us to cover in future shows. Email us at info@easybaby.co.za.
But reflux is not all bad news, though. As long as babies are not in pain and they're gaining weight properly and they're not dehydrated, the research says that a certain amount of reflux is actually good for babies, because it takes the good bacteria from the breast milk that baby swallows into the stomach, and it moves that good bacteria up into the airways, where it can fight off bad bacteria and possibly other airway disease. So as far as what causes reflux, well, we have to look at what pops that valve open. And the winner by a country mile for popping that valve is overfeeding. Although I like the term overeating more, because overfeeding kind of implies that you as the parent are just shoving these unnecessary calories into your baby's mouth to keep them quiet, while it's generally more a fact that your baby is crying for food, and they're crying because possibly they have a tummy ache and they want to put food inside to be able to stretch the muscle of the tummy, or because maybe they're just looking for some sensory nourishment instead of food, and they're spending a lot more time eating to try and get that. There is good evidence that reflux babies benefit from smaller, more frequent feeds. Eating too much too quickly allows a lot of gas to move into the stomach with the food, which causes pressure on that valve again. Or the valve itself may just be too immature to be able to handle the normal pressure that the stomach puts on it. Strangely, some of the literature talks about a lot of crying actually leading to reflux because of the pressure that this crying creates on the baby's abdomen. And I see many cases that start out as colic and end as reflux, and this might be one of the reasons behind it. There is another side to reflux, which is how quickly your baby's stomach can empty the contents into the bowel. If this takes too long because either the muscles of the stomach and the bowel are not coordinated properly or the food is too thick, this also lends itself to reflux because the new feed now has nowhere to go. Reflux is unfortunately very, very overdiagnosed in babies, and may be caused rather by organic issues like lactose intolerance, cow's milk protein intolerance, or mechanical issues with other shortenings or narrowings of the bowel. Therefore, it's really important that we do some proper testing just to eliminate these other potential causes. And if your doctor feels strongly enough about the symptoms that your baby has, he or she might send your baby for a barium swallow test. So this happens at the hospital, and it is the least invasive test that you can do for reflux. And the good news is that you get to stay with your baby. Barium is a white chalky substance that shows up on X-ray, and we use it to see how far up the fluid level sits in your baby's throat. So this test can tell us if milk is moving up and sitting too high in the baby's esophagus, but this test doesn't tell us anything about how acidic that milk is. A more invasive test that can be done is something called an upper endoscopy, and this is when your baby is sedated and a thin tube with a camera on is placed in your baby's mouth and down the esophagus into the stomach. So this allows us to see if there are any narrowings potentially inside the gastrointestinal tract that could be causing reflux. It also allows us to see if there's any tissue damage onto the esophagus from the acid. The gold standard, though, of reflux testing is something called the impedance pH monitoring. I have had to go through this as an adult, and I can tell you that the experience is not fun. A tube goes down your nose, right down the esophagus, and it stays there for 24 hours, while a computer measures literally everything, from fluid level to acid level to the amount of air that's in the esophagus, and it correlates these findings with your baby's feeds and what your baby's been doing. it details literally every minute of activity. So this is an excellent tool for diagnosing silent reflux. It is, however, hideously expensive, and usually we find that the docs will rather put the baby on a course of antacid medication to see if there are any changes in the symptoms and diagnose that way, rather than put babies through this huge impedance pH testing. Speaking of treatment, there is a lot we can do for these kids at home before we hit the doc's office if we suspect reflux. First off, reflux babies must be fed with their heads above their feet, even slightly. Preferably you use a breastfeeding pillow to support both of you in this position. Otherwise, if you feed baby flat down, the milk just sloshes backwards and forwards over that loose valve during the feed, and it has the potential to irritate your baby. As we talked about earlier, smaller, more frequent feeds are very beneficial, especially for reflux babies. It's a biological thing. If we look at the makeup of human breast milk, we see it has low protein, low fat, and high carbohydrate content. This means it's supposed to be digested quickly, and it's supposed to be digested often. And this is one of the traits that puts humans in a constant feeding group instead of other mammals whose breast milk is designed to give their babies longer gaps between the feeds because they have more protein and they have more fat in. We are designed for smaller, more frequent feeds. This also keeps the acid in baby's stomach diluted with milk, which means that there's no pure acid that can move up and burn on its own. If breastfeeding, sometimes your letdown reflex can be quite forceful, and this means that baby will take in more air because he or she is gulping down the milk trying to keep up. So slowing your flow rate has been shown to really help reflux babies, and one of the best ways of doing this is to lie back at more of an angle when you feed to be able to calm the flow. I would suggest, however, if you are having problems with that, get hold of a qualified lactation consultant. Babies should be burped at least once, if not 2 or 3 times during a feed, to eliminate the gas that pushes up against the valve. And then you need to carry on winding for 20 to 30 minutes after the feed. I'm going to link my winding video that I've got on YouTube. I will link it in the show notes so you can have a look at that. It has a lot more information on the burping of babies. New research is showing that the majority of air that babies swallow happens in the first 2 minutes. So another good idea for reflux baby is to break baby off the breast or away from the bottle after the first 2 minutes if possible, and try and get a burp out there. There is also no rule that says that you cannot burp a baby before you feed. A lot of babies swallow air before they eat, and this ends up underneath the milk in the stomach, and that ends up causing pressure. Babies must be held upright after a feed for anything from 20 to 40 minutes to allow the milk to settle in the bowel. There's also great research at the moment that talks about sleeping kids onto their left-hand side. If you sleep a child on their left-hand side, their stomach will empty 60% faster. And as we've talked about, how quickly the stomach empties does have a big effect on reflux. Lying these babies down on their right-hand side or on their back exacerbates reflux terribly. Sucking a dummy has been shown to empty stomachs faster, and it causes better throat clearance in babies. A pouch or a sling is invaluable for a parent with a reflux baby, because putting children down onto their back for a long period of time, this is a very new Western idea that causes huge amounts of reflux when there needn't be any. But if you carry your baby upright in a sling or a pouch, it's beneficial not just for the reflux, but also for the general digestion of your baby and also for sinus clearing. Thickeners work quite well for the happy chuckers, but they have no effect on acid reflux babies, and thickeners are not recommended for preemies. If you are on formula, check with your doc or your clinic sister about the different AR formulas versus the different HA formulas. Both have been shown to be beneficial in reflux depending on the situation. Breast milk, as we all know, is still the best, and it's the best for reflux because although it is thin and it is easily vomited up, the point of breast milk is that it is very thin and it empties out of the stomach even quicker, and this aids reflux more than it causes it. As a chiropractor, I work on the nerve supply to the gastrointestinal system, and that allows the muscles involved to move the milk through baby more quickly, more efficiently, out of the stomach, into the bowel, and through the digestive system. Now, if nothing else has worked, and the acid is causing complications in your baby, your doc might prescribe some meds for you. These meds tend to block the stomach from creating acid. These medications should stop your baby crying, but only within about 5 to 7 days. Because even though the medicine starts straight away by stopping the creation of stomach acid, it still takes a while for that burn in the esophagus to heal. So as babies are still drinking past the burn, they will still be a little bit irritated to start. It is important to realize that these medications do not actually stop reflux. In fact, they can make the actual reflux itself slightly worse, because your stomach closes the valve when it realizes there is enough acid in the stomach to digest the food. Now, when there's no acid, the valve doesn't respond properly and it doesn't close properly, and you get more reflux. Also, remember that stomach acid is there for a reason. It is your stomach's first line of defense against infection. And so these medications should really only be taken if it is necessary. It's also been shown that they can slow down the absorption rates of vitamin C, vitamin B12, iron, calcium, and magnesium. The last ditch attempt, if nothing has worked, is surgery. And the surgery that we do sometimes is called the Nissen fundoplication, where part of the stomach is wrapped around the bottom part of the esophagus, which creates a much stronger partition between the two. So that is reflux in a nutshell. That is what it is and what causes it, and the tests that you can do, and a lot of home advice for things that can make life a lot easier before you make your way off to your doc. I hope that shed some light on reflux for you. If it did, please be sure to share this podcast around with other moms and dads that you feel might get some benefit. But otherwise, check out goodnightbaby.com if you are having those sleeping issues. Otherwise, my name is Dr. Mike Marinas. I will see you next time. Enjoy your baby.
If you enjoyed this episode, please subscribe. And remember to check out our pre- and postnatal education courses at easybaby.co.za. You got this.